Welcome to episode 4 of the Bite podcast. October is Breast Cancer Awareness Month, and here at the Dental Studio, we believe in holistic preventative care, not just for your oral health, but your whole body wellness. In this episode, we'll be talking about how lifestyle changes like healthy eating, regular exercise, and reducing toxin exposure can help play a role in overall health and disease prevention. Your GP and regular screenings are vital too. It's all connected. While October shines a spotlight on breast cancer, taking care of your health is something we should focus on every month. We hope this episode empowers you to make more informed choices for your future health. So long story short, there's a lot of patients coming into the dental studio world, let's just put it like that, and asking about oncology referrals, ENT referrals. I feel as the years go by, there's so much patients that are becoming shy. They don't want to talk about certain things. They're just hiding it under the carpet until something goes wrong. Yes, we are specialized in, diagnosing something orally, but I really want to build a platform where I get specialists like yourself. So if anyone asks, I can immediately say, please speak to Dr. Hassan. He's the one to go to. Or if so this is just providing a link, to be fair. I know you got 30 years experience, triple board certified. I think you're the best person to talk to. And obviously I would just love you. I just honestly like your insights. As soon as I got your referral to speak to you, I was like, I have to have you on this podcast. The dental studio has been around for decades, and I feel the thousands of people that we can just having you on here, it will help, let's just start off with one or two things. What would your short paragraph be, the anatomy of cancer?
So, two things to this question. First, in male and female, because they're a little bit different in male and female, and then the age group. So, I would say, obviously, cancer, the word cancer is an uncontrolled growth that happens in the body. It could include any organ, again, both men and women. Now, the key point in cancer, as you alluded to in your introduction, is early detection.
Yeah.
So sometimes there may not be much symptoms. So that's what we call, there are certain screening tests that we recommend as oncologists, that even the GPs, general practitioners, should be aware of these things and recommending them to their patients. Unfortunately, that is not happening in real world because the GP usually are very busy. They may see 40 patients a day. I don't know, but they have 5 minutes per patient. And the last thing they have time to discuss with their patient is, you need to do this and that. Let's mammogram or pap smear or colonoscopy, for example, or something like that.
Yeah.
So what I tell patients, because the first answer I get from even regular people will talk, well, I don't feel anything. Why should I do this?
Exactly.
So when I say the word screening test, screening is supposed to be a test to be done in the general population of the target age, let's say, before they have any symptoms. Because if they wait and say, well, now I have blood in my stool, for example, unfortunately, that may be too late. I mean, it could be as simple as hemorrhoid, but colon cancer is now on the rise. 250% rise in colorectal cancer in the last decade alone. So it's becoming the number one killer in men in here. In UAE, it's the number one killer, it's colorectal cancer.
Oh, wow.
In women, it's number 2. So what we did what the UAE government have done in the recommendation now, they lowered the age also. That's another huge thing happening in the last decade or two, is the young age for cancer in general.
Yeah.
And the number one age that is really not in any books. If you open any book, they tell you, colorectal cancer disease in the 60s. I can tell you 90% of my patients are below 60 with colorectal cancer, and 50% are below 50. Okay? And more than that, 10% below 30 even, I will go to say that. So age is not anymore a factor. So in UAE, they lowered the age of screening colonoscopy to 40 years of age. Even worldwide, it's down to 45 years of age worldwide. So US, some Europe countries, they lowered the age from 50 to 45 because this is global. incidence. The incidence of colorectal cancer really on the rise, and attributed to really our lifestyle, our overuse perhaps of antibiotics, our type of food we are eating, the fast food, which is doing, what is it doing is changing the bacterial flora in our guts. So what we call microbiome.
Yep.
And the microbiome interaction with our immune cells apparently is very critical to a healthy immune system. Yes, really get rid of any cancer cell changes. So if you have a cancer changes in a cell, the immune system is supposed to come and really take that cell and take it away.
Yeah.
What happened is because of this microbiome changes in our guts, the immune cells are becoming more inert or cold, we say, against the cancerous changes. So that's the theory why we are seeing a rapid rise in certain cancers, specifically in colorectal. That's more attributed to the environment factors and not to genetic factor. Of course, there are genetic factors, you cannot change that, but there are environmental causes that are really now reshaping how we should approach the idea of how do we prevent or detect early cancer. Why is it important? Because if you detect cancer early, okay, you pick a cancer, breast, colon, lung, anybody detected in stage 1, curable across the board in 90+% of the cases. So why colonoscopy? Let's focus on colon cancer.
Yeah.
Because colonoscopy detect polyps. And we know 90% of colon cancer start in a polyp. And for a polyp to form and transform into cancer, on average 5 to 10 years. So if I do colonoscopy on you, for example, and you have no polyps, you can be assured like in the next 5 to 10 years, you will not have cancer because you need to have a polyp first, and the polyp has to be a malignant polyp. Not all polyps are malignant, or pre-malignant, I should say. And for that pre-malignant polyp to change into an active cancer. So that process takes on average 5 years plus. So that's why colonoscopy is extremely effective. If I do in a patient colonoscopy and absolutely no polyps, we can tell them don't come back for colon cancer screening for 5 years minimum. How many patients or people, let's say, are doing colonoscopy above age 40? Take a guess in UAE.
I'll say about 15%.
That's too generous. First
Wow.
answer was the correct one. Five to 10%.
So would you say the prevention is it's low here, the screening?
Yes, multifactorial. First, patient never aware that it is required. Many of them don't have a family doctor. Even if they have family doctor, half the family doctor do not mention it to them.
Yeah.
I say that because I get the patient, 55 years old, abdominal pain, or liver metastasis, colon cancer. Did anybody mention to you, Mr. Smith, that you needed colonoscopy 15 years ago? No, nobody ever mentioned that. This is a very common patient presentation. I see those patients, unfortunately. What we don't want to see in the future, continuation of this.
Yeah.
If we screen the population that need to be screened, we can reduce colon cancer by 90%, 90. But it is not being done. It is not being done, unfortunately. Okay? So we can eliminate colon cancer pretty much if you do colonoscopy on everybody over age 40 almost.
Yeah.
But it is not being done, unfortunately. Now we have some people are afraid, they don't want to do colonoscopy. Okay, at least do a stool occult blood testing,
Yeah.
These can be done now by mail. They can send you the cards, you put some stool sample, send them back by mail, get it tested for blood. The problem with testing for blood, if you have polyps, they don't bleed. Many polyps don't lose blood. So the test may come back negative. So it can give you false security. So it is an okay test. It's a cheaper test, but it is not the gold standard. It should be a colonoscopy, hands down. Now, there are CT scan, colonography, but you still have to drink the stuff and clean your bowels and colon before you do the colonography. And if you find a polyp, then you have to have a colonoscopy later on. So why not just clean your bowels and just do the colonoscopy? You'll be asleep. I have done it 10 times already myself. So I like it myself because they put you to sleep for half an hour. I get the best.
Yes, of course. Yeah.
When you wake up, it's all over,
Yeah.
So my message on colorectal cancer, anybody over age 40 in UAE, it's recommended to do a screening colonoscopy, and that will save lives, okay?
Amazing.
Metastatic colon cancer is deadly in more than 70%, where early colon cancer is curable in more than 90%. Look at the big difference.
Yeah.
Okay, that's one. Going to breast cancer, the number one in women, of course.
Yes.
In fact, in UAE, about 37% of all cancers combined are breast cancer. And again, age is not a factor anymore. We see in their 20s, whether many a time pregnant. Every month we present cases, she's pregnant and there's a breast mass growing. So in the 20s, 30s, 40s, no boundaries here. Again, age is not anymore a number. But in general, what's the recommendation? Screening, mammography plus or minus ultrasound above age 40 for regular women. For women who have family history, especially younger than 40. Okay. As a rule of thumb, if you have a cousin or a sister who has breast cancer at age 38, then your age of mammography should be at least 10 years younger than that. Okay. So you can argue even at age 30 or 28, you may need a screening ultrasound or mammography or MRI. Why MRI? Because young age have very dense breast and it will not show very well on mammography, can miss up to 25% of breast cancer. Therefore, we combine it with ultrasound, and if need be, we do MRI, which is much better test for younger, more dense breasts. So if you have genetic disorder like a breast cancer gene called BRCA1 or 2 in the family, or you have it yourself, then it is better, certainly, to start screening at a younger age, even 25, if you have the BRCA gene at age 25. Again, mammography or ultrasound or MRI, any modality save lives. Why? Because when you detect cancer early, at the pre-malignant even, there is something called ductal carcinoma in situ cancer. In situ means they haven't had the ability to cross their membrane or their boundaries, but they are malignant cells. So if it's a matter of time, in a short period of time, they can change from being in situ carcinoma to invasive carcinoma. And that's why when we detect calcification in a mammogram, many of these could be pre-cancer condition, and the best thing is to remove them surgically, with or without radiation, etc. Or a woman may prefer to remove the whole breast if they don't want, radiation therapy. Whatever the stage or the case, we have very effective therapy in breast cancer. But again, nothing compared to early detection. Next week is the breast cancer month. So luckily, the October month is becoming educational time for women in general to do mammography, okay? And we need to continue to do that. The uptake of mammogram, let's ask you now a question. What do you think the uptake of mammography in women in our country?
I think that's pretty low, to be fair, because I'm getting patients asking just random questions. What do I do? Where do I go? The preventative nature of it is quite low. And people, like I said to you again, they're shy. They don't want to. They'd rather just leave it until the end or just go, you know what, I'll deal with it later. I've got a family, I'm stressed, I've got work, I've got this. So I'm going to say low. Maybe I'm going to say like 20%. Let's put a number to it.
So you're a little bit better here, yes. So the number, the latest number is closer to 25%, 25 to 30%. So we're doing much better than colonoscopy. It's less than 10%.
Oh, man.
But with all the education we're doing, imagine 3 out of 4 patients are not getting screening mammography. That's terrible. Again, like you said, some people are shy, some don't want to go to the doctor. You know, in this country, many are covered, hijab, etc. They don't like to go to the doctor. And it's a sensitive subject. But unfortunately, 1 in 7 or 1 in 8 women are still getting breast cancer anywhere in the world.
Yeah.
Very high very common. So in a room with 50 or 50 women, you can bet that probably 6 or 7 of them are going to have cancer, breast cancer. So not a joke. It's very common disease, very common.
Serious, yeah.
And again, finding cancer early is the best way to cure it. Okay?
Yes.
Early breast cancer can be curable, and again, 90% plus, if not higher. When you leave it to become stage 3, where it goes to lymph nodes under your arm or in the neck or bone, God forbid, the liver, lungs, brain, there is no boundaries for cancer once they take off.
Yeah.
Then it becomes incurable. You go from 90+% cure to less than 30% cure rate. So very important screening. And when we say screening, also in breast cancer, personal exam is critical. You go to the doctor maybe once a year, but you are with your own body almost every day. So what we tell patients, at least once a month, at least, do a formal exam on your own breast. Some people say, I don't know what I'm looking for. Well, look for anything new. What I tell people, look for any changes. I know you're not a doctor, but if you do that regularly, monthly, look for anything new. Let's say your nipple get inverted, or you have little dimpling on skin. You raise your arm, you look at the mirror, you see changes in one breast versus another. Those are all ominous signs that you look for. So look for any new changes. We know you are not a doctor, but look for any new changes in your body that may indicate potentially a malignant process, especially women anywhere between the ages of 35 and above, I would say. High risk patients who have family history, who are known to have BRCA genes, are a different story. But in a regular population, I would start the physical exam, personal exam, really above age 30, and definitely get a baseline mammography ultrasound at age 40 minimum. Patients who don't get pregnant, and many of that happening now till they are over 40 sometimes, they have higher risk of having breast cancer. So age at first pregnancy is also important. Breastfeeding, by the way, decreases the risk of future risk of breast cancer as well. It's a protective effect. Early pregnancy, breastfeeding, these are good things to have. Birth control pills, there's mixed data. If you take combination, more in the perimenopausal age group, if you take combination of estrogen and progesterone, there is a slight rise in breast cancer, yes. But if you take just hormone replacement with estrogen alone, the data is actually negative, no increased risk if you take just estrogen alone. It's the estrogen and progesterone combination that increase the risk of breast cancer.
Wow.
So, unless you have a question, we can go to other organs.
No, so I actually wanted to speak to you about stress and immunity with oncology. I've read up about, because obviously the lifestyle we live now in the 21st century, it's fast-paced, people aren't eating healthy, it's stressful. Obviously, those are environmental risk factors to developing any sort of cancer. Obviously, I'm not an oncologist, but could you just give me some insights on stress and immunity with that part?
Very good point, very good question. I kind of answered part of it. If you remember when I was talking about diet and pace of life and lack of sleep, sometimes you can add all that.
Yeah.
There is lots and lots written about stress level and the immune health.
Yeah.
Our immune cells, are as healthy as our body. Meaning, if you are working 18 hours a day, or if you are always stressed, you are not sleeping 4 or 5 hours a day, you feel weak, right? You feel ill in a way.
Yeah.
And this is how your immune cells feel, by the way. It's a mirror or reflection of how you feel in general. So yes, stress will decrease your immune health, will allow more cancer to grow unnoticed. Remember what I said, we have daily cancer changes in cells.
Yes, yeah.
But the immune cells is what's keeping them away.
Yeah.
Once my immune system becomes weaker or at a disadvantage, then yes, this is when the tumor cells can evade the immune cells, or the immune cells get weaker in the recognition of cancer or tumor changes, and slowly the tumor will be forming, unfortunately. So very, very important to decrease stress level. And you know what else? Sport added to that. Patients who perform regular sport function have actually a more healthier immune system.
Yes.
And we have proof of that now. We have large studies in breast cancer survivors, those who were on a regular program doing whatever sport they want to do, jogging, biking, treadmill, but do it on a regular basis, at least 2 to 3 times a week, 15 minutes only, versus stay sedentary lifestyle, no regular exercise, as many of us do. Fascinating results after 5 to 10 years. Imagine we give chemotherapy and hormonal therapy to prevent breast cancer, right?
Yes.
By 30-40%. So listen to this. Exercise alone decreased breast cancer recurrence by 20 to 25%. So if you are a regular exercise performer, you have 25% less chance of cancer recurrence versus somebody who doesn't exercise. And 3 months ago at the Chicago ASCO meeting, our Society of Clinical Oncology in America, they presented the first large data set on colorectal survivor, cancer survivor. Same exact benefit. Those who for 5 years did regular exercise after their treatment have 20% less recurrence. That's 1 in 5 less recurrence at year 5. Why am I mentioning that? Because that's linked to your question about the immune system. This is the theory that these exercise, there is nothing like exercise and staying healthy to keep your immune cells healthy. There is nothing like good night's sleep that our grandmother used to advise us. It is very true. Lack of sleep, hard stress, always on the stress tense side, tend to have a lower immune system and therefore more chance to have cancers. So let's finish with the lung cancer. The other big epidemic in the world is lung cancer. It is still the number 1 killer. The people who die from lung cancer is equal to breast, colon, prostate cancer deaths combined. So if you combine all these large volume of cancer, lung cancer death is more than the other 3 combined. This is how bad is lung cancer. So here, of course, we can prevent it by stopping smoking if you are a smoker. Because smoking causes 75 to 80% of lung cancer are in smokers. Of course, smoker will tell you, well, I know my grandfather smoked for 80 years, he never had cancer. Yes, true, not every smoker will have cancer. But 80% of lung cancers are smokers. And if you take particular type small cell lung cancer, 100% of small cell lung, which is the deadliest type, are smokers, heavy smokers. Of course, there is nothing like preaching about stopping smoking because not only lung cancer, smoking causes 50% of human cancers can be attributed in one way or another to smoking, okay? This is how bad is smoking. And let me take that opportunity to say, non-cigarette smoking has not been studied for cancer. So these are now, we have the type to ICOT or the smokeless tobacco. There may be less hydrocarbon damage to the lungs or less COPD if you want emphysema changes, yes, but not yet studied for cancer risk. So we cannot say this is less cancer forming than a regular cigarette or cigar or what have you. Tobacco, unfortunately. Cancer risk is the same. The best thing here is not to start smoking at the youth level. Because when do you pick up smoking? In your teenage group, mostly.
Friend smokes, you smoke. Your mom smokes, you smoke.
Unfortunately, the data is not good. Still, youth smoking is high, unfortunately. And that's because of peer pressure and many things. Everybody like the smoke still, or now they smoke less tobacco. Not a good sign, because I don't think we are anywhere near stopping lung cancer by stopping smoking. But The trend worldwide is down. So there is less smoking in the world, with few exception pockets in the world. But in general, especially here in UAE, the smoking rate is less, actually. That's why we don't see lung cancer as on the top, number 6 or 7. But when it happens, it is a deadly disease. Yes, there is screening. That's why I'm mentioning lung cancer. Besides stopping or not starting to smoke, we can do now. Anybody age 50 with over 20 years of smoking history, they are eligible to get annual low-dose CT scanning of the lungs. This can save lives, yes, because you detect nodularities that are early, less than 1 centimeter before they change into cancer sometimes, and it is proven to save lives. So yes, there is screening above age 50 for lung cancer by doing annual low-dose CT scanning for lung cancer. Okay? Now, just to finish on specific situation, cervical cancer, oral cancer are both linked to HPV virus.
Yes.
The good news worldwide, we have a vaccine recommended for teenagers. In US, where the uptake of the vaccine is very high, like 80%, 70%, there is a huge drop in cervical changes due to the HPV virus, and also drop in the oral cancer that are linked to HPV. So in these cases, the virus, of course, is the culprit, but it is a sexually transmitted virus, unfortunately. And that's why it's important to start vaccinating little girls and boys before they start to have any sexual relationship to avoid the spread of the HPV virus. Okay, and it is asymptomatic. You don't know if you have HPV or not until you do your first pap smear sometime. There are some dysplastic changes. So again, HPV vaccine now up to age 40 is recommended, even if you are up to age 40. Even if you have HPV, there is improvement in cancer occurrence if you take the vaccine, even if you are already carrying the HPV, by the way. So uterine, ovarian cancer, high risk group mainly. There is no regular screening for ovarian cancer, unfortunately. In high risk patient, meaning family history of BRCA also, it's familial ovarian cancer, then it's better to do ultrasound plus CA125. It's a blood test that we do as a screening for high risk population. But if we follow colorectal, breast, lung, and add the prostate in men, we're also easy. We can do a PSA level at age 45 to 50 and annual PSA test. You can also save lives in prostate cancer that way. If you follow these 4 things I just went through, cancer cases will drop by more than 50% because these are the most common cancers. But unfortunately, it's not happening. And
this is like I said, this is one of the reasons why I've just built a platform so people can just get information and say it is fine to talk about it. You know, speak, talk. Please get the screenings. But I just want to say thank you. You literally are fantastic. No one or everyone I've spoken to about you speaks highly of you. So I just want to say thank you for your time, your effort, just your knowledge. Is there anything you just want to leave us with, just for like a top tip or a memorable story? Is there anything you just want to leave us with? Well, with the whole of the dental studio, let's put it like that.
Sure. So what I would say, relaxation is always important. Your body has some rights on you. I know it's a stress here to keep working and generating money. Dubai is not a cheap place to live in. But always remember to, we say back to nature in the old days. This is true. It's always good to unwind for a day or two every now and then. I know we take vacation sometime for 3-4 weeks, but it's always good to unwind 1 day or two every month. Your body has rights on you. Don't pick up smoking because it's a bad habit. It's proven to cause cancer besides heart disease. We didn't talk about the 1,000 other things smoking can do. The other epidemic I didn't mention, I failed to mention it. It's very, very important. Weight control. Obesity is the new epidemic, and it is as bad, now we know, almost as bad as smoking. So I cannot stress weight control. Why? Because the weight gain in this country and other westernized country, also US, Europe, same problem. 50% of US population are overweight. And what we know about obesity, again, it can cause up to 40% of human cancers. Control your weight, exercise regularly, watch your diet, and always remember relaxation, behavioral changes. It's not worth it getting too stressed all the time. And follow the screening test and particular ages I mentioned. You should be.
I'm a huge advocate, so you'll be seeing me around on the breast cancer awareness specifically. But no, please, thank you so much for your time. I'm grateful. I know you're a busy man, but no, I just want to say thank you from the bottom of my heart. Thank you so much, and have a wonderful evening.
My pleasure. Thank you. And although I'll be out of job, but I don't mind being out of job.
Thank you so much.